Thank you all for joining us for our SICSS-Howard Mathematica Roundtable. Please enjoy this introduction to panelist and Senior Director of Health Equity, Deliya Wesley.
Hi, I'm Deliya Wesley. So what is your background? My background. So I'm a health services researcher by training. I have a background in public health and health disparities research. After thinking I wanted to be a doctor, much of my early years, I got my bachelor's of science in anatomy and cell biology. So I consider myself very much a recovering bench scientist. I started out with a bachelor's, which I received from McGill University in Montreal. Thinking very much that I was on the medicine track before discovering public health. Went on to do a master's in epidemiology at the George Washington University School of Public Health, where my concentration was in cancer epidemiology. So looking at disparities in breast cancer outcomes, by different patient demographics. So I spent a few years actually at the National Institutes of Health in the clinical genetics branch, working with teams who studied hereditary cancers and looking at cancer risk and screening and communications about risk and clinical decision making among different populations as a result. I later went on to focus at the doctoral level at that context piece and understanding health-related clinical decision-making for different populations, and really looking at the contextual factors that influence specific health outcomes. So what we now talk about is social determinants of health. And again, at the doctoral level, my focus was actually on cancer and understanding clinical trial decision-making, particularly among Black patients with cancer, and how to improve access to and interaction with different health services, given a history of distrust, as we know, and a history of abuse and systemic and structural barriers, in particular within the healthcare system. So I am the Senior Director of Health Equity within our health unit at Mathematica. In my role, I'm charged with developing or really defining a vision for our health equity work within the business unit, and really developing and implementing a strategy for that work, which allows us to be more intentional about the work we're doing in this space across our research and evaluation portfolio, and giving us the ability really to be responsive to client needs in both the health foundations space and our federal and state government clients as well, who are really focusing on health equity now and having these critical conversations. So in my work, I have an opportunity to work across different project teams, serving as a subject matter expert, directing health equity focused projects, helping project teams think through methods and approaches, and ensuring we're centering equity, or really that we're leading with equity in mind as we do our work in the unit. And not just in response to clients, but as a way of how we do our business. What excites me about my work at Mathematica really is the people and the work that we get to do together to improve public well-being. And not just in a hokey because that's our actual mission type of way, but because as a health equity researcher, that's very much the embodiment of what my training and experience is aligned with. I really love the broad range of different projects I get to experience or work on, and honestly, working with so many very, very, very smart people and on such important work, it actually impacts, working on such important work that actually impacts people's lives because of the policies shaped by the evidence that we generate. There's always an opportunity to keep on learning, and I really love that about working at Mathematica. So learning new methods, constantly learning new approaches, learning new ways of thinking. I consider myself very much a lifelong learner, as I think many people here are. So that aspect of working at Mathematica really excites me. In terms of my career trajectory, what shaped my career? I would say that what shaped my career is literally every day prior to this one. And I've seen my career path as definitely something that didn't necessarily make sense in the moment, but to look back now, the path sort of seems very clear. I spent the majority of my career working in a large, diversified health system as an embedded health services researcher. And for many of us doing health equity research, or back when I started, it was distinctively health disparities research. You'll often hear the phrase that this work is very much akin to pushing a boulder uphill. And in healthcare, being able to have some impact through research and directly influencing care delivery was one thing. However, like many people during the pandemic in particular, things really changed, right? I think for one, it finally shone a light on what many of us as health equity researchers had been saying for a long time, right? This was a drum we'd been beating our whole lives. But what came to light for me and what really shaped the trajectory or put me to put a sort of fine point on it in many ways is recognizing that there ultimately was only so much you could do as a health services researcher, either identifying or understanding social determinants of health, for instance, but that ultimately if the research was to have an impact or influence or shape or drive policy, that those are the changes that needed to be done, and to close the gaps or to actually impact inequities. Ultimately, it's the policies that needed to change, right? And so that's why the work we do here at Mathematica is so exciting, A, but so critical, B, because as a company, where through our work we get to generate, as I said, that evidence that directly impacts change. As a health equity researcher, that's really powerful and really what brings me to this stage of my career.
Thank you all for watching. For more information on SICSS-Howard Mathematica, visit our website, follow us on social media, and join our email list.